All right, Vinita, I think we can go ahead and start admitting. Thank you. Hi, everyone. Good afternoon, or good morning, or good evening, depending on where you are joining us from today. My name is Miriam Ofonadu, and I will be helping to facilitate this session today. So thanks for joining us for Division 37 during SIG, which stands for Diverse Racial, Ethnic, and Multicultural Special Interests Group. So today we are going to be hosting meaningful and responsive community partnerships with all of you. So we thank you for being here today. I just want to give a quick reminder, some housekeeping things. Please, this meeting is being recorded. We would like it to still remain very interactive, so we invite you to please use the chat box to post comments and post your questions in the chat box, and feel free to keep the conversation going in the chat box. And also, if you're uncomfortable leaving your video on, please feel free to turn that off. You can keep your microphones muted to help us minimize distractions. At this time, I really would like to invite everyone, as we continue to come in, to post in the chat box which state or country you joined us from, the organization or school you are with, and your professional role within your organization or the community. Let's just go ahead and start getting to know each other and collaborate, which is what this session is all about. Thank you so much for doing that. And I'm going to also put that information in the chat box, so as people are joining us, they can post who they are and what role they play within their organizations. So I'm going to put that in the chat box. Okay. All right. So just a quick overview of Division 37 of the American Psychological Association. So Division 37, Diverse Racial and Ethnic Multicultural Interest, Special Interest Group, our mission is to actively address issues that are impacting children, youths, and families from historically underrepresented diverse populations and communities. Our goal is really to provide our members with the opportunity to be able to engage in a meaningful collaboration, whether it's been through training such as this, community outreach and engagement, as well as information dissemination. Our work actually includes 3 main focus areas that is informed. Those are informed by our members' interests. And they include training and education, community outreach and engagement, as well as information dissemination. And just a quick update for our members, for our SIG members. The SIG recently created 3 subgroups to work on each of our 3 focus areas. And each subgroup have already met or scheduled to meet to begin their work, which includes providing members with the opportunity to be able to identify the strengths as well as the needs that they see in their clinical practice, in their supervision of trainees or research that directly impact the lives of children and youths and their family from historically underrepresented population. Our goal is that this type of collaboration will help to continue to inform the work that we do as a division, as well as the work that APA does. In addition to that, we also encourage members, if you are an American Psychological Association member and a member of Division 37, please use the QR code that you see on the screen now, or you can go to the website to be able to complete an interest survey. It's very brief, but you can open up your phone now and take a picture of the QR code. You should be able, it will redirect you to the SIG interest survey form where you can complete. So we put you in our listserv and make sure that you can help get involved in the work that we are doing. At this time, I would like to invite our colleague, Stephanie Maider, one of our SIG activities coordinator, to introduce our panelists. While she's doing that, I invite you to continue to post your response to the chat, introducing yourself, telling us who you are, where you're calling from. Thank you so much, Steph.
Hi, everyone. Thank you for joining us. So first today, we would like to welcome Dr. Cynthia Izuno-McCree, who has served 35 years in the U.S. Navy as a gynecologic oncologist in a variety of academic and executive leadership roles before moving to the Pentagon to serve as special assistant to the Chief of Naval Operations for Diversity. In retirement, she's increasingly engaged with veterans issues such as homelessness, self-management programs, veterans and women's health, and substance use, mental health, and suicide. She is the author or co-author of over 20 scientific papers, 3 book chapters, and over 200 invited presentations. In addition, she has received numerous community service awards for her innovative youth outreach programs to inspire middle and high school students from educationally, economically, and experiential diverse backgrounds to pursue careers in science, medicine, and technology. Currently, she serves as Vice President of the Board of Directors for the Asian American Center of Frederick on the Executive Committee for the Japanese American Veterans Association, as Vice President for Health for the Asian American Intercommunity Service, Vice President for Education and Integrative Health for Lift a Vet, and on the Steering Committee for the Asian American Health Initiative for Montgomery County, Maryland. In December 2017, she joined Eagle Force Health as Senior Vice President and Chief Medical Officer. Thank you so much for joining us. And we'd also like to welcome and thank Allison Jones for joining us today for this conversation. Allison Jones is a dynamic leader with over 10 years of experience conceptualizing, developing, and executing strategic programs where nonprofits, public organizations, and corporations work together to make an impact on communities. Builds value by leveraging relationships with community-based organizations, schools, influencers, legislators, and corporate partners. She is a team player who understands how to balance strategy and business acumen to best invest resources and maximize impact. From work with the United Way, leading people-focused initiatives to work with the Atlanta Hawks in social responsibility, Allison has created several successful strategies driving community change. Allison now serves the National Black Child Development Institute as Vice President of National Partnerships and Community Mobilization. Thank you, Allison, and thank you so much for being here today, both of you.
Thank you so much, Steph. I really appreciate that great introduction. And one of the things that Dr. Macri, as we were preparing for this session, did remind me is that all of these achievements and award is really nothing to her other than her family and her ability to kind of be able to fold her sleeves now that she's retired and get involved and work with communities. So I would like to invite Dr. Macri to open up the conversation by kind of telling us a little bit about herself more and the work that she do within the communities before we start responding to the questions all of you have kindly sent to us in advance, and we will be having our panelists respond to those questions. Dr. Macri.
Thank you very much. I'm really, really excited to be invited to speak here. And I would like to shout out to the Temple University student that in the chat box, because I am a Temple Medical School graduate. And one of the things that I learned, started my career really in the direction that it's taken, is when I had a patient as a third-year medical student. You know, as a student, they tell you way more than if you're the attending, right? So the student said to me after she was berated by the attending, he leaves the room and she turns over to me and she goes, "Do you think we want to live like this?" And that struck, you know, like it was like a dagger through my heart, right? Because, you know, we all have come to every place that we go with a different perspective, right? And then, we always try to superimpose what our experience is on others. Like, why can't you do this? Why can't you get, you know, out of the circumstance? It's like, you must like being, you know, back in the old days, it was like people saying, oh, you must like being on welfare. Oh, you having a bunch of babies. I'm a gynecologist, right? So having a bunch of babies so you can get more money from the government. And those types of you know, assumptions and really hurtful stereotypes, it really shut the door. And I know one of the questions on here is about barriers, and that's one of the first barriers is when you start out with this assumption, and every conversation that you have with anybody is based on proving your stereotype to be right. People don't come to these conversations trying to be persuaded or to have an open mind about things. And my whole, like, one of the things that I've noticed since I'm going through this list of participants is I'm really old. That's the number one thing. I have a lot of experience, but you know, you get that from age, right? That is one of the things that my mission in life is to and then how say I never really thought. So if you guys have well, you can put that in the chat box if I say something that maybe you hadn't thought of that way. So my internet connection is unstable, so I might be fading in and out. So all right. Anything else, Marion? Well, one of the things I do want to say, because it's because that's one of the things Marion about with is that one of the things that I really did that also from when I came back to the States, I came back to the United States from overseas. I was an American expatriate living in Islamabad, Pakistan, actually, in high school. So I came back to the States for college, and holy cow, it was the biggest culture shock ever coming from a developing country to the United States, where it seemed like everybody has everything. And I realized that that is not true. There is a lot of stuff here, but only some people have some stuff. And in my job now as in a technology firm, it's every day trying to make sure that everybody understands that making an app or doing some kind of technology for people who already have technology is not equity, right? It's like my big number one concern is giving more stuff to people who already have stuff. My mission in life is to spread that out. So help people acquire things, but also to understand how the utility of those things. So anyway, that's
Thank you so much. Thank you, Dr. Macri. Allison, do you want to share a little bit about your personal journey and the work that you do in the communities before we open up to questions?
Absolutely. So first of all, I'm really grateful to be here with all of you. The National Black Child Development Institute is the organization that I represent, and it's a 50-year-old organization that exists to improve and advance the quality of life for Black children and families through education and advocacy. And so our vision is to one day see a society that ensures a successful future for all children. Through our national affiliate network, which is essentially chapters of our organization, through them, we are able to implement powerful programming, policy, and advocacy activities that embolden and empower Black families and Black educators. And so my role at NBCDI really encompasses working with corporations and national partners to help move forward our mission. And then the other part of my role is to support and lift up the work of our national affiliate network and ensure they have what's needed to thrive. This work cannot be done in silos. It cannot be done alone. And so partnerships and our network are both vital functions of our work. And just personally, I have always worked in the social good space. And so just learning about the barriers, learning about the ways that we can have meaningful partnerships. I'm excited about that part of the conversation because I've had a lot of experience in those areas and on those fronts.
Great. Thank you so much, Allison. And thank you for that reminder of need for partnership and collaboration. And that's the reason why we're here today. Please keep the introduction in the chat box coming. We have a great and diverse folks of people here, and we're excited that you have joined us. So as I wrote in one of my recent articles on this topic about responsive community partnering, we really need this even more now than ever as we try to really wrap our head around the issue about health inequities, the social injustices, the services, the treatment, even the vaccine access issues, institutional and systemic racism, which the COVID-19 pandemic has made more even notable in our institutions and communities at this point. So our society really want to do as much as we can to impact the life of many, especially the underserved and the marginalized people among us. And we know if we are going to call ourselves agents of change or change agents, we should put ourselves in a position where we are bringing voice to the spaces and places where there is no voice with regards to oppression, those who don't have the voice to voice out the issue of discrimination or even discriminatory practices, and for all of us to come together and stand up for what is right and just. If we are to be able to do that, we need to be very open to that during this session and kind of do a little bit of reflection. How are we engaging with the communities in which we are embedded in? How are we being able to connect with the people that are on the ground? How are we putting the stakeholders that are those who are moving the needles in their communities? How are we bringing them to the tables as we make decisions about policies or interventions to put in place? So today's session, the two experts that have spent many years in communities, working with people, being on the ground, fold up their sleeves, are going to be able to be sharing with us some of those insights that they have gained and give us some strategies to continue to be a part of that mission. So Ms. Allison Jones, I would like to invite you to start us off with our first question here. So the first thing that we are going to touch on is about meaningful and responsive community partnership. What is it? And I'm going to kind of give us, I will start us off with this before we go into barriers and facilitators. So why is community responsiveness and meaningful partnership important?
Yeah, so the fact is that there are many inequities across the Black community. COVID-19 placed a highlight on the fact that Black communities have health disparities and challenges. And then, the issues of social justice in the past few years has highlighted the many challenges we face in that area. And then all of this has now shed light on the need to finally be rid of systemic and institutional racism. So with all of that, meaningful and responsive community partnership is vital, and it's part of the answer. So we need allies who will listen to the Black community, who will make intentional partnerships with Black organizations and organizations who support the Black community that are doing strong, evidence-based work, and that are listening to the voices of the community. So are they having those community listening sessions? Are they paying attention to what's being said in places that maybe are not institutionalized, like neighborhood groups and block clubs? What will you do? What is the action after you listen? And being really intentional about, understanding what those needs are. And then, of course, what are you going to do after learning about those needs?
That's excellent. Thank you so much for that reminder about need to really embrace the allies. And also the reminder that those who are calling themselves allies truly understand, and we can view them as an ally based on their actions and how they are able to engage in partnership with the work that we are doing. Dr. McCree, would you like to add to what Ms. Jones just said?
Yes, and I actually had a kind of a little bit of a awakening in the last few months in the fact that Asians have always been somewhat invisible. The numbers are small, and actually, although the Japanese American Citizens League was the earliest of the civil rights groups, it was formed because during World War II, well, first of all, there was the Chinese Exclusion Act. There were all kinds of immigration laws that passed that made it, if you were not white, you could not be a U.S. citizen, right? So this immigration issue has been very long in coming. And one of the things that I learned was that if you that the immigration laws are based on, or the quotas are based on the percentage of people that are already in this country, right? So, ignoring completely the Native Americans, what they did was they said, well, we have X number of Germans, we have X number of British, Irish and Scottish. So that's the percentage of immigrants per year that can come to this country, which is why it takes, like 17 years or something even longer than that for an Asian Indian, for example, to get citizenship of this country. And so we have to kind of look at not just what's happening today, but what's happened in the past. And during World War II, the Japanese Americans born here, like my dad, were put in relocation camps during World War II because they were considered to be a threat. It was easy to segregate Japanese and Asians in general from the population because we just looked different, right? It was also easy to exclude us because, it's not like, like if I was talking to you on the phone, you wouldn't know that I was Japanese American, right? But because you can see me, you can, and I look different, then that was the easy way to discriminate. But what's happened is that the Asians are finally coming together as a group, because within the Asian population, we have a lot of differences in our faiths, the way our approach to things, where everybody is in society, right? The Japanese, Chinese were here longer, so of course they have a bigger presence and they've achieved higher status, but it's a matter of time, right? And then, but you have immigrants and refugees here, which I think we can't ignore, right? There's a lot of diversity within the Asian community, and we have to now come together. And I loved what you said, Allison, about allies, because we didn't ever organize except during, and now we have the great opportunity to learn from each other and to stand together. And I think that that's long in coming. We've always, the minority groups, because we're minorities, right? We've been, kind of competing for the same dollars and competing for the same programs and competing for this, like siblings, right? Trying to get our parents' attention. And so now we have a golden opportunity to collaborate and to, we'd be able to lift people up in certain areas. But the one thing that I do want to talk about in terms of institutionalism, there's a lot of misunderstanding, I would say, in the among the majority. And one of my jobs in the military was to try to change the way 4-star admirals and generals, the guys that buy the airplanes and the boats and the ships and tanks, those guys, to try to get them to understand that that unit cohesiveness or working together as a team is really predicated on each other understanding each other, not accepting each other necessarily. We don't all have to be friends, but to understand what brought people to this point. But the thing we had in common was that we all volunteered for service, right? There's 0 draftees in the US military today. And so what I had learned, and you guys probably, scientists in this group, probably know a lot more than I do, but the one thing I talked to them, very superficial, but very deep at the same time, is I talked to them about a new science, not that new, but a new science called epigenetics, which means that the stressors that we have faced over generations actually can be passed on from one generation to another. Because even though our DNA might be exactly the same, if we were identical twins, our DNA could be exactly the same. If I had a different experience than my twin, then I would have a different, I could have a different DNA, part of my DNA exposed due to that cortisol levels. So it's actually science. You can't just erase, hundreds of years of discrimination just by saying, now we're the same, you're my buddy, we're in the same unit, blah, blah, blah. That doesn't work that way. We have to understand that there is more science behind it than just what happened, in the last decade, or in this case, in the last couple of months. So I think our ability to express our feelings in the context of our experiences, not just making a statement, but trying to go the next step. And you'll hear me talk a lot about the next step, because you have to kind of, we are obligated to somewhat explain ourselves or describe what we mean, because what we're saying might mean something to us, might mean something completely different to someone else. And some of the words that we might use would seem to be, maybe more hostile than we intend, because it's not what we meant, right? But it may be. So we have to kind of not only express our feelings in the context of our experiences, but possibly even try to understand why people might react a certain way.
Thank you so much, Dr. Macri. I am reflecting on what you are saying, and just I'm hoping everyone here is also doing the same as we continue to reflect on these things, and really a good reminder to all of us, and thank you for that, the need for cohesiveness, the need to even be able to build on the experiences that people bring when we are going into those spaces. It's one thing going in, right, to knock on the door. It's another thing being able to understand the experience that the people that you're knocking on their door bring with them, to allow you to be able to really enter and engage with them. So thank you for that huge reminder. And I will now turn it to Allison to open us up with the barriers and some of the facilitators as we struggle and look to engaging with our communities. We want to engage, but sometimes we run into some of the obstacles, whether it is meaningful cultural responsive partnership, how we can better understand the issue of the needs, and how do we translate those needs to become strengths and assets that are within the community. So if you can just kind of touch on the barriers and facilitators of meaningful and culturally responsive partnership when we are working with support services, including mentoring programs, schools, any organization that serve children, youth, and families.
Yeah, I think this is super appropriate because Dr. Cynthia was just talking about the misunderstanding, and that there's a lot of misunderstanding. I think we don't always understand each other, and we are not educated on history or the data or the facts. And so I think one of the barriers with partnership can be a lack of education and misunderstanding. I think that there are some well-meaning organizations that decide to raise their hand and be an advocate or a partner and don't fully understand some of the challenges. Sometimes they move too quickly and don't have all the necessary information and education. For example, before working in the education system, do you know the real life issues around suspension and expulsion among children of color? Do you know the data around preschool suspension and how it outlines that Black children represent 19% of preschool enrollment, but 47% of preschool children receiving one or more out of school suspensions? And so, we're talking about pre-K. We're talking about kids that are having toileting challenges and being super active or raising their voices. These challenges exist today. And so I think one of the barriers can just simply be lack of education and understanding. And, that is something that can be addressed and resolved. That's the exciting thing about it. Another challenge can also be the issue of respect, understanding that people need to own their own change, add resources to communities so that they can be part of their own change and they can own that, be respectful enough to allow them to learn, take those tools and build success in their communities, right? This is also an opportunity to be a really good listener and take the time to kind of understand the community that you're trying to focus on. And this makes a big difference, and it definitely makes an impact also.
That's great. Thank you so much, Allison. Dr. Macri, would you like to add to that?
Right. So Allison, education was on the top of my list too. So, I'm gonna leave that one, and I'll start with a couple of other. So there's a couple of other barriers that I've run into, right, or that I've observed, and a couple of them have to do with assumptions, right? So making assumptions or walking into a situation like you were talking about, walking to a home, making a certain assumption closes off the conversation before it even starts, right? Because one of the things so let's talk about COVID-19, right? The vaccinations. how are vaccinations being allocated or denied to certain groups, whether it's by design or if it's by accident, right? So one of the things that I've heard like 1,000 times, right, is that if you just set up this vaccine clinic in a church, you'll get Black people to come and get vaccinated. That's, I mean, how many times have we heard that, right? It may be that that's not the best place, right? Maybe it would be a someplace where people are already going to get food, right? Because sometimes for some people, faith is a personal thing, and maybe that they don't attend that church, right? It's like, you know, my coworkers here don't necessarily go to a Baptist church. They may go to an Episcopal church, which is, or they may go to a different type of a non-denominational, for example. But maybe if you want to really reach into the community has the greatest need, maybe we should set these vaccination clinics up at places where they receive food. And so I think that sometimes making assumptions can be a giant barrier to whether or not we're able to collaborate because of the exclusion, because it excludes other groups or makes other people feel uncomfortable. But facilitators to collaboration is exactly what you're talking about, Allison, about education. Some people just, I mean, my thing is I would like these people that raise their hand, want to help. I want to know, what do you know about me? Do not assume that what you're going to offer me is what I need. That's the first thing I need. I may need something else first, and then we can talk about something else. And that's why, I focus around food, right? Because that may be the thing that we need to break down. And so for the Asian community, we always get giant attendance for the Asian History Month celebrations. Why? Because we have food, right? Everybody likes Asian food. So they come to this, the Asian food celebrations. They don't come to listen to what we have to say, or the fact that, we were put in relocation camps during World War II, or the Chinese couldn't buy land, something like that. They come here for food, but it opens the door, right? So we can have that discussion with them. So that's kind of where I am. But in my situation personally, one of the barriers that I had to any kind of mentorship or anything like that, right, was that the stereotype for Asians about being smart and, whatever, all of the being competitive and all of that kind of stuff, that is equally paralyzing when that's not equivalent, but it is equally paralyzing when you consider that. So I might've been lucky, but I joined the military, right? I didn't have any money. I did join the military for the scholarship and had reaped way more benefits. But so that's, I think, we have to understand, or we have to realize that that everybody comes with their own experiences, and that we need, whether we're in a racial, ethnic, or other vulnerable community, that we can that we facilitate by helping people to understand who we are and what our concerns are.
That's great. Thank you. Now I'd like to invite Valerie, who just raised her hand, to ask her question before we move to some of the questions that we received. Valerie?
Thank you, Dr. Afandu. I wanted to ask about engagement, getting folks engaged who are not yet allies, but we're trying to get that understanding going that you both are talking about, and trying to get that education disseminated to the people who really need it. And right now in my department, we were able to establish a diversity and inclusion committee that actually it has teeth for the first time since the department started. And that's really exciting, but we've been working on developing these trainings, and we're trying to decide whether or not to make them required. I was of the mind that we really should make it required, to show folks that this is really something we value, and getting this education out there is important. But there have been other folks who are worried that requiring the training would kind of put it in this basket of, oh, it's another thing I have to do. They won't be as engaged when they show up. They won't be as likely to engage with the material or be insightful. So I was just wondering if y'all had thoughts about kind of how to start inviting people in and trying to get that information disseminated. What is the best way that you have seen in doing so?
So I'm sorry, I'm going to jump in here because I have a lot of experience with this actually. I was the vice president for recruitment and diversity at the Uniformed Services University, the military medical school, and then I advised the chief of naval operations. And the chief of naval personnel. So this is, so I don't know about everybody else's experience, but a lot of times that diversity and inclusion lecture, quote unquote, gets put on Thursday afternoon, right, of the week. So everyone's trying to check out of their hotels or change their plane reservations or what have you on Thursday afternoons, right? So you put the one diversity lecture at the end of the thing that does not communicate that you think it's important. So what I did is I told the chief of naval personnel, no, you go in, you talk about it on the first day, right? And then you break up the committee so that it's not like all the, and you make it clear that just because you are Black or Asian or Hispanic, your next job is not going to be a recruiter or a HR person or an EEO person for your command, right? Why can you not be the legal officer? You know, as a collateral duty, like, why can't you be the legal officer? Why can't you be the environmental health officer on the ship, right? Why is it that because I'm female and I'm Asian, right, that I have to be the diversity on the ship? How does that make, I mean, are you assuming that because I'm female and Asian that I'm going to a spokesperson for every woman and every minority on the ship, right? And so I told him, you gotta be kidding me, right? It's not a Thursday afternoon small group. It's a day one exercise that you do whatever the you come up with a icebreaker or a group where everybody can voice their opinions, and then you collect all the information on that survey from the first meeting. So the key is buy-in, leadership buy-in, right? They gave you this committee. They told you that you can do certain stuff. Yeah, well, have him or her welcome the group. Have him or her, the leader, talk about the importance and operationalize it. And that's what we did. And we changed the structure of the leadership and management for the department head course, where it has become a first day thing, and the same thing with these Heritage Month celebrations, right? It's not for us to sit around and talk to each other about what we already know. The whole idea is to engage people who don't know. So go out with a survey. What do you not know? What are your assumptions? What do you not know? That kind of stuff. And then it's very interesting reading what the results are, because some of them really are hostile, but you can break through those, right? Invite them and ask the next question. Why do you feel that way?
Valerie, I'm glad.
Yeah. I'm sorry. Okay, you go ahead.
No, I was just going to say, I'm so glad she asked this question because I don't have as much experience. But what I do know is this should be a priority and a requirement because it's foundational, right? So if you think about anything else, any other prerequisite, right, to start something, you're doing that because it's foundational. And it's foundational because it's important to build on to get to the next thing. And I feel like this is absolutely something that should fit into what is required before you really get started, because it is absolutely foundational. I think something else that's really important to keep in mind when you are implementing things like a class like this or something, I think it's really important to keep in mind that everybody that, represents a group, whether it be, African American or an Asian American, they are not the leaders and they do not represent their entire race and culture. Because I have been the token before and asked all the questions and that can be very overwhelming, and it also makes you kind of feel like, wow, I'm representing an entire group of people. And I think what we need to make sure that we get to when we're being intentional about this, and when we're saying this is foundational, and when we're starting day one, is to make sure that everyone feels part of the learning and everyone feels like, wow, I don't have to own this just because I'm the only Black girl that's here, right? And so I think that's just a really important piece to kind of keep in mind as you're doing something like this. But I like what you said about it being a requirement because it's important and it's foundational.
Well, and
Thank you.
the other thing is, remember, all white people are not the same, right?
Right.
Like, I mean, if you get somebody from Idaho, it's not exactly the same as somebody from Alabama or North Carolina or Washington, D.C. I mean, it's like, why do they make, how do we allow them to make the assumption that we're all the same when, I'm like Asian, like the biggest country in Asia is Russia, but they don't call themselves Asian, they call themselves white. Right. So those are kind of the things that I think that's exactly, it is foundational, and diversity, and I kind of misspoke. It shouldn't be like the first lecture, right? It should be part of every lecture. It should be part of your entire curriculum. It to bring out to ensure that everybody understands that and it doesn't matter what you're discussing. If you're discussing, maternal mortality, or you're talking about lead paint or environmental exposures or anything like that, happens to everybody. That's not restricted to one group or another, but understanding that people may have different resources, et cetera, et cetera. So it's exactly what else. It's foundational for every lecture, for every event, and we call it unit cohesiveness and productivity, because we are the military.
Thank you both so much.
Right,
so I just want to, so I am understanding, I just want to make sure, it sounds like you're saying definitely make it a priority, or try and help leadership see that it's a priority. And if using that word requirement might put people off, that's okay, as long as once you're in it, you're really trying to bring people in, but make it a requirement. One thing I'm really worried about is not making it a requirement, and then, like you said, people who already have the information, already know it, are just talking, but the people who really need it aren't really getting it. Like, people who already understand the barriers are there, but the people who don't have that education aren't.
Yeah, I think you're understanding just fine. What I also think, though, is we have to stop the way we're thinking about this. We're making it so complicated, right? So when you go to a class, you get a syllabus. That's just what it is. That's just the norm, right? If we begin to make this part of every discussion, part of every conversation, part of every class, every event, it'll just become the norm. But we have to practice that, because that's not something that has been the norm, right? So being able to access your email from your phone is the norm now. But there were years ago when someone said access email from your phone. What? How do you do that, right? It has to be practiced. And then once it's practiced, it's just going to become second nature to us. But we have to be intentional about practicing it. And so I just feel like that's where it comes in. don't think so complicated about it. Oh yeah, it's absolutely part of this because it's foundational. That's just what it is.
Thank you, everyone, and thank you, Valerie, for that question. And I think that actually puts us into our next question, which is on collaboration and how we can effectively collaborate with diverse community stakeholders and incorporate their input in all phases of our research, our trainings, our project planning, the implementation and evaluation of those projects. How do we get them to be a part of the promotion of those initiatives and to support and sustain a shared goal and decision-making dialogue at all levels, not just local level within our organization, but also on a state level, national level, and also international levels. So how do we begin to really pull people in to effectively collaborate with us, especially the stakeholders within communities?
Mm-hmm.
Dr. Margaret, would you like to start off with that?
Yeah, sure. So this reminds me of not knowing anything about the college that I went to before I arrived there from, Islamabad, Pakistan. I get back to the States in Eastern Pennsylvania, where the population is an engineering school. The population of the school is 1.4% non-white. So that was a big shocker to me. Plus everybody driving on the wrong side of the road and all of that kind of stuff. So, so I think one of the things that I thought a lot about this actually is to to start with that making a point of understanding that, like we were saying, both Allison and myself, what we were saying is that we can't represent the whole, the totality of our race or our gender, right? And by the same token is you're not being more diverse. You know how the schools are, right? You're not being more diverse if you just because you go to Cameroon and you have study abroad or something like that. That's not exactly the same as, because it's one different culture, right? Instead of trying to understand the cultures that make us up is, I think, as important. So you want to make sure that you are inclusive in this, that any of these programs are not quote unquote targeted. I hope I'm not using the wrong language, because I'm a cancer surgeon. I'm not a psychologist. I use my hands, not my brain. but anyway, traditionally, we've all had, the focus groups, we've invited experts and stuff like that. And that's great. And I understand, I saw the comment and the thing, it is great to use published research and stuff like that to inform some of our presentations and that sort of our discussions. But the bottom line is that sometimes you just have to collaborate. You just have to understand your community and what the regular people are thinking. What are their barriers? Not what does somebody from Rice University. I'm just throwing that university out, but it could be any university. What a publication about some urban something in Houston, is that as relevant to Charlotte or Richmond or Baltimore? And so because the people that are living in our own communities that we can reach out and touch, those are I think we get farther when we try to understand our own community, and we can draw in the resources from, let's say, some big multinational conglomerate like the Gates Foundation or AWS. We have to help them to understand that the concerns of a group in Los Angeles might be different than the concerns of a group in San Jose or Chicago, or Little Rock, Arkansas. And that the context of that community includes the history of that community. So you can't just say, I'm going to give scholarships for STEM. So that was one of the big things that I worked on in the Navy was STEM graduates. Like I wanted people to understand science, technology, engineering, math. And so, but you can't just say, I'm going to just give out these scholarships, right? You have to understand, I think it's our obligation to help people to understand what the barriers might be in my community or in this community that I'm working with. And in so doing, we can educate the grantor, right? The guy that's spending all the money on us, the grantor, we can help them to understand by that what the context of our communities are and how diverse our communities are. And diverse is about race or ethnicity or gender or any other preference. And the thing is that it is so easy to look at data in just silos. And in medicine, what you learn is that, and it's probably even more true in disciplines like social work, is that people don't generally have, only hypertension, or they don't generally have only diabetes, or they don't generally only have allergies, right? It's all mixed together, and every single experience or condition has a weighted impact on what your outcomes are and what your interventions might be. So I think that's one of the ways that we can try to effectively grab these stakeholders and make their input or their interventions a little bit more effective.
Thank you so much, Dr. Macri. That was very insightful. Thanks for sharing her wealth of knowledge. I think one of the things that kind of stuck out to me is my good reminder too, is that we should stop looking at data in silos, which sometimes we tend to do. And when we box in into our narrow lens and not inviting different viewpoints to help us really better understand the communities or the people that issue have been impacted on, it makes it hard for us to be able to tailor the interventions that we're trying to put in place to actually meet the needs of the people and the communities that we are trying to assist. So thank you for that reminder. I think another reminder that builds on our next question is this idea of making sure that the experience or the context actually includes the history of the community, what you're bringing in, how you are crafting your research question, especially, you're talking to a bunch of psychologists here, and we love to help people. However, then when some of us, given the limited time that we have built into the work that we do, it makes it really hard for people to be able to really effectively and meaningfully collaborate with people. So Allison, do you want to talk a little bit about that in terms of people in the leadership position, which actually is going to put us to our next section. If you're in a leadership position, how would your organizational culture, how could you as a leader within your organization create alliance and make time and resources available and even providing technical assistance to your agency staff so that they can effectively engage and also sustain, not just engaging, but sustain the community collaboration efforts that they are trying to embark on.
Right, and I think there are two parts to this. I think the first part is collaborating effectively, like we just talked about, means being intentional about your commitment to listening and also being consistent in practice, right? So who's in leadership on your different projects? practice what you preach. Who are you doing business with on these projects? What kind of consulting firms are you hiring for the things that you have to get done? You're doing a project in Philly, and yet you've got this suburban consulting firm that comes in to do your events for the community, right? Where are you recruiting folks from? And so how are you part of really changing the narratives in that particular community and emboldening that community? And so I think that it's really about thinking through how you can be intentional. Set time at the start or the end of meetings to hear folks' voices, to hear ideas and get suggestions about who you should be working with, and organizations that will help, lift up your particular project or effort that you're working on. There should always be time for ideation around things like this. Kind of like, what I said to Valerie is that we have to practice this, right? Sustainability of partnerships starts with real, meaningful relationships. Just like any other relationships, you can't have a successful relationship without putting in time and listening and learning. And so, the fact is that community collaborative efforts are work just like any other aspect of our business. It's just something that has to be done. It has to be worked on, and you have to make time for it. And, it requires us to put in some work to make, it requires us to make some time. And then again, after it becomes a practice, it then becomes a priority. And so I just feel that, those are the kinds of things as leaders we need to be thinking about. Okay, I have to be intentional about this. I have to fit this in, just like I have to, talk about, my open door policy or my preferences for communication. I got to also talk about this. And so again, if we make it a practice, it will then become a priority.
That is so great. Dr. Michael, would you like to?
Yeah, for leadership, right, is that they have to fund it, right? And I don't mean only money, although for a lot of diversity projects, so let me just tell you what happened in the Navy, right? So we were on this trajectory. I got the generals and the admiral, and we were really convinced that we had made some progress, not a lot, but going backwards, right? And then we changed leadership. And what ended up happening is it coincided with a budget crunch. I don't know if you guys are old enough to remember sequestration, and that's when all the diversity programs got cut, including the sexual harassment programs, right? All because no longer, which part of the budget can we cut? Well, this looks like a fluff program. So, and this was the new administration, and and that's kind of what happened in 2012 in the DoD, right? Is you had the sequestration was the perfect excuse to cut programs that were not considered warfighter programs. But one way to think of this, and getting back to Valerie, is like, think of things as a warfighter, right? What do you need to be an effective, to win, right? To win effectively, and diversity and understanding each other and optimizing our strengths, which are very diverse, really makes you a more effective fighting force. And so it's still a pretty good metaphor, although I'd like to also acknowledge that in today's environment, as minorities, violence is not one of the things that we would like to promote. But funding is not only money, right? It must include money, but funding also includes the leadership investment in time and in talent. So the people, one of the discussions that we had was, this Asian guy, Chinese guy, who was in a certain level of leadership in a Fortune 500 company. He was like busy patting himself on the back on how he was this, there's no discrimination because he's this. And I was like, well, let me guess, you're the vice president of what? Research and development? And he goes, how did you know? I'm like, because you fit the picture of somebody who's might be good at research and development. So they have pigeonholed you since the very beginning into this, only they've convinced you and you agree because you were trying to go up this ladder. This person, this R&D vice president is never, ever going to be the CEO of this Fortune 500 company. The guy that's going to do it is the guy that's in marketing and sales, right? Or something like that. So be careful about those how you as a minority, whether you're a female or just, I mean, a woman, or you're a racial, ethnic minority, or some other community that they're actually talking, but also marginalizing. Be careful. We just have to be careful about that, and we have to call them out when they try to make you the EO, the diversity officer. Just ask them. How does this fit into my plan to be a commanding officer or to be the CEO? It's okay. You can add your input.
Thank you, Dr. Macri, for that reminder. One of the questions that came in privately to me that I think is important to touch on, that you also started already to touch on, is that these researchers or staff and faculty members at universities sometimes don't have time to build a rapport with our community. You don't have time to establish these relationships. And the community now begin to look at researchers as those who they call them or refer to them as swappers. They come in and they swap in, they collect the data, and off they go. Well, how can this be addressed, and how could community stakeholders better play a role? And again, it goes into the organizational culture, like you're saying. If that expectation is not set up as in the higher up, it will make it harder for the research faculty members to be able to really adopt to it. Is there anything that you could add or help with this question of how do you connect with the community stakeholders if you communities already have this mindset of, I'm not gonna trust you, you just come in, collect your data, and you're gone and published, and I don't even read the article you publish.
I think that's a challenge. I think that, it's required to make the time. So that has to be built in. I think working with community-based organizations that are trusted will help, right? Because they already trust those particular the community already trusts those particular organizations. I think listening is what those organizations do best. The ones that do really great work in our communities, and there are a lot of them doing really great work in our communities at the grassroots level. We're not talking surface level organizations that, don't know much and are just, again, swooping in and doing research and coming back out. We're talking about those grassroots organizations that already have the relationships and have already done the listening. They're hosting community listening sessions. They're meeting people where they are, going to the heart of wherever that research is coming from, and really getting to understand who's at the center of that work. And these organizations are having listening sessions in places where community members feel comfortable. So whether that be a faith-based organization like the basement of a church, or a neighborhood group, or a community basketball court. But when you go where people are and meet them in their element, you communicate that you want to make an effort to know them, to understand them, and to meet the needs so that they can be self-sufficient and successful, no matter where that place is. So I think it's really crucial to look at grassroots organizations as partners and to say, okay, these are the kinds of organizations that we should be working with so that there's already some trust that's established, and being really sensitive and respectful of the relationships that already exist between them and the community members.
That is great. Thank you so much, Ms. Johnson. I think your reminder to us about after it becomes a practice, then it becomes a priority. And I kind of wrote that down. So you have to continue to keep this and do this. It becomes a practice, and then it will become a priority. That way, if somebody tells you to check your phone, check your email by phone, is something that is normal. You don't have to look around to kind of figure that out. You can just do it. so it becomes a priority. So thank you so much for that reminder. That actually is going to lead us to our next call to action and the role of APA as we think about APA as an organization. And we think about this need for mindful, being intentional in your ability to collaborate. How could an organization such as the American Psychological Association help to establish authentic relationship within communities so that what they are doing, including the public policies for children, especially those families from historically underrepresented diverse population, can also be in line with what is standard, evidence-based? How can they do that as an organization? So what would you tell us?
So do you want me to answer that?
Yes, Dr.
Thought
Macri.
about, okay, I actually have thought about that a lot, even before this meeting, because as Allison said, I am actually working with a number of grassroots, nonprofit, community-based programs. In fact, I learned about the community health worker program from the Texas A&M because they started out doing this migrant health care in the Valley, Rio Grande Valley, using Promo. And I brought that up to Frederick, Maryland, to the Asian American Center of Frederick, because I thought it was so critical that that people receive kind of culturally relevant or even language relevant care and form a bridge between our healthcare system and these communities of refugees, immigrants, and low English proficiency groups. I mean, I got out of the military and I've had to the first time appointment with a civilian doctor. That is very daunting. Besides which, asking me what my insurance number is, which I have no idea what it is, and stuff like that. I mean, it's intimidating to try to navigate through for healthcare in a system that you're not familiar with, and even worse, that you're not familiar with. So I'm going back to the original thing that Allison was talking about listening, because as educators, we tend to preach because we know a lot, but really to be effective in the community, we have to know what they think, not what we know. We want to know what they know. And so one of the metaphors that I like to use is your toolbox, right? So I have a toolbox, you have a toolbox, everybody's got their own toolbox. Now, as a doctor or as a professional in the healthcare space, we tend to rifle through our own toolboxes, pull out a tool, whether it's a recommendation or a medicine or a procedure, right? And you hand it over to the patient and you tell them to use this tool. And they're looking at it like you're from Mars, right? And so I think been more effective community.
I think we're getting bad connection from Dr. Macri.
Programs.
There she comes. All right, Dr. Macri, I think your internet is slow. And we are going to, let's see if we can. Okay. Allison, do you want to kind of take it from where she stopped? And I think she's going to try to reconnect. You're muted.
I'm sorry. Yeah, no, I actually really appreciate her sentiment.
Never or almost.
Yeah.
Definitely. My relationship with my mom is not perfect, but it is rocky. But ever since I got back from the hospital, I feel like it's gotten better because now I know to control.
Okay. Yeah, I was going to say, I really appreciate her sentiments. And I think that the main thing is, like what we said, listening and then putting those things that we're hearing into practice. And also, what is the response going to be after you do the listening? So I think, a lot of times what happens is, and she gave some really great examples, but a lot of times what happens is we'll do a lot of listening and collect the information, but then what's the action after that? What are the next steps after that? How are we being respectful of what the needs are? And then really making sure that we're meeting those needs and moving forward in a way, again, that's very respectful of that community that we're trying to work in. And you're muted, Marian.
I have to remember to unmute myself as we are talking about call to action and the role of APA. Thank you. Okay, I just muted where the feedback is coming from. Dr. Macri, I think you're back. But I was
just getting good too.
Yes, we got disconnected. So we just wanted to make sure your internet is back on. Thank you for coming back online. While Allison is talking, we were just, and I know I have the past president of Division 37, APA, that now that we're talking about call to action and the role of APA, I would like to call on Marianne McCabe, if she's still with us, to kind of touch on this. Marianne?
I am. Can you hear me?
Yes.
Great. Thank you so much. First of all, my sincere appreciation to the two speakers today. Such a nice kind of in-depth conversation here. I think it's fairly shocking that it's taking us so long to consider, involving community voices and equity and diversity to be so foundational. I liked the analogy of, suddenly we all have smartphones and use them and we wondered how we ever lived without it. But it's kind of horrifying. So I also want to just give a shout out, of course, to Dr. Ofenadu, who's been an unbelievable leader in this space for Division 37 and in establishing this Dream SIG. And thank you so much for putting this on today and letting me speak to this. Many of you may know I'm a candidate for APA president in the next cycle, president-elect in 2022. And I can honestly say the reason I'm running is that APA is finally poised to do a much better job at all of this. There's so many silos that have been broken down just in the last few years. Some of it due to the incredible leadership of Dr. Arthur Evans, who's the CEO, and some of it due to just, I think, societal change and recognition that that working in silos is just not effective. And it's that inspired me after a career working, across disciplines and breaking down silos. It's that inspired me to think that maybe my passions are finally a match for where the association is right now. And I just celebrate a lot of what's been said today. And I want to just double back just a second to what we were just hearing, which was what happens after we learn a little bit more about what the community needs and involve them in research, or for that matter, in practice. How do we make deliverables make sense for them? I think it's because we have to keep the relationships going. And I can honestly say that the reason that I'm interested in the presidency of APA is because of the relationships I've established across different kinds of psychology. I think without those relationships, it wouldn't have been a perch where I felt like I could make a difference. So I just want to celebrate what everybody's been talking about today in terms of both foundational elements, and also the importance of relationships and collaboration. And thanks for giving me a minute to talk, Marian.
Thank you, Marianne. All
Just
right.
I wanted to say something just in response to Marianne, because I have so much respect for leaders who value this. Leaders who value diversity, equity, and inclusion will always be more successful, transparent, approachable, passionate about the work, and then the mission and emboldening others. So everybody just keep that in mind as you think about the best leaders for the presidency or the APAF. I just feel like that is something that's so important. And it always warms my heart when I hear leaders talk about this being important to them. It matters. It definitely matters. So I just wanted to share that.
Thanks, Allison. Thank you. As we talk about strengths and strengths that leaders bring, let's also touch on another question that came, and thank you those who continue to send comments and questions directly to me, that based on what we consider strengths and needs, as we think about the pandemic and we think about what's happening right now, what are some of the most pressing concerns, including those that are related to mental health of students and educators, and even the return to school in the fall? Well, the fall is almost here. As we think about return to school, how can partnerships effectively address these concerns in a culturally responsive way? Dr. Macri or Allison, any of you can take that on.
Okay, it's funny that you should mention this, Marian. So this has actually been the focus of my work for the last 2 weeks, 24 hours a day, 7 days a week without sleeping, right? Is this vaccine equity. And what's really disheartening to hear is you know, the narrative about how we you know, we have to do more education in the Black community because of Tuskegee, right? And so while there is a certain percentage of the African American population that does remember Tuskegee, and that for whom it is very, very central, and it's not just Tuskegee experiment, right? It's also the Henrietta Lacks issue, right? And it's also, as we saw in the military, is how African American soldiers never received the recognition that they earned in World War I and II, and are only now receiving their upgrades of their medals, or even any medals that they earned alongside the white soldiers while they were in segregated units. And I think a lot of people don't realize that African Americans went to war for this country in every war, including the Revolutionary War, and never received the credit that they deserve. And so things like that do follow you. This is what I was talking about epigenetics, right? These are generational effects that are very, very damaging and very, very long lasting. So in our communities, we have engaged, or in this work, we've engaged groups like the 100 Black Men of America, and they've taken basically to their communities. And what we're trying to do is we're trying to we actually are, my company's actually has filled out the paperwork from the CDC to reallocate vaccine from the Walgreens and the CVS's and the Publix, right? And put them so that we can give the vaccine in the communities where it is needed, right? And so the thing is that you can say that vaccine uptake is low in the African American and Hispanic population, but did you look at how you distributed it? Because for some, you know, and myself, I'm giving vaccines at this Chinese Community Cultural Center clinic, right? Well, last week, I vaccinated somebody born in 1927, and we're opening up the state to 16 and above, right? So just because we have our cell phones doesn't mean that cell phone or internet access is available to everyone. And think about all the rural, agricultural, migratory workers, all of those people. That's where, if you want to, quote unquote, if we want to put our money where our mouth is, that's where we're investing, and, quite a big investment actually, in trying to get the vaccine out to the communities of color, and to not buy into this, vaccine hesitancy. And what we have found is that it's not a matter of distrusting the vaccine once they've been educated, once people have heard the whole, the information about the vaccine, how it came to be, why it was so quick why we were so able to so quickly develop an effective and safe vaccine, right? And what we're going to do, how are we going to follow people afterwards to ensure that we can collect the data on communities that have previously been excluded from participation in clinical trials. So it's not just, the assumption that African Americans and Hispanics and don't want to participate in clinical trials. It's not 100% because they don't want to. It's because they've never been included. And so that's the narrative that we're trying to change. So every minute of every day, we're trying to do that, and are engaging the community-based organizations who already have a footprint in the community and will be there they were there before we got there, and they're going to be there afterwards. And hopefully they will be operating in a fully vaccinated environment to be able to provide all of those services that they've been relied upon to provide.
Excellent. Ms. Jones, do you want to add anything to that?
I'm just going to say thank you, first of all, and that, we are grateful for this kind of work, and the issue of access, making sure that, folks have access, but also understanding and education around what they're getting is super important. And so I'm grateful for that work. I think some of the other challenges, though, when it comes to going back to school and educators going back, that we've been hearing, is also just getting back into the swing of things and thinking about, some folks who have not had access to internet and computer and all of that, and yet have to get back into the swing of things in the classroom. It's been a challenge. Black educators have reached out to NBCDI with questions on, what's going to happen. We talked about summer learning loss. Now we're talking about spring, fall, and summer learning loss when we're talking about children and families. And so there are actually quite a few challenges that we're going to have to begin to sort through. And I certainly don't have all the answers, but these are just some of the things that, are existing. I know, as a parent myself, I've been a home educator, right? But every parent doesn't have access to the kind of resources I have access to. I'm privileged. And so, in thinking about that, there are just a lot of challenges that kind of go with that. So I think this is an area of opportunity for us to think about how we can support and help everyone.
Miriam?
That is so great. Let me just make sure that nobody raised
Miriam,
their hand. Yes. Hi, Julia. Would you like to ask a question or make a comment?
Yes.
Okay, absolutely.
Okay, I just wanted to share my experience, with and at APA, working with communities and coordinating, a large program, and Miriam was part of it. Liz knows about, Mary Ann knows about, and many other people. So it is possible to create an intervention that goes into communities and brings, science in a very, adapted and developed for communities, and how, to work with them, within an association like APA. And if some of you work or, have plans for working, with organizations, it is possible for you to develop, initiatives, or just, embrace and implement all those several that are well evaluated. The one that, I did at APA is evidence-based, And we worked with the communities, low income minority communities here in the US, all over the country, with mostly Latinos and African American parents, to educate them to raise their kids without violence. And we also took to many, many different countries. And the lesson that I would like to share with you is that first you need, if you are not part of that community, you are an outsider coming in and offering something. First, you needed to have, allies, companions, partners over there. You don't come to any place like say, well, I'm such and I'm come on behalf of APA and I have the best thing in the world. That's not how it goes. So you need to spend a lot of time creating relationships and knowing people and understanding their needs and where they are at, with their needs, because many times they know their needs, but they don't have the ways and means and the infrastructure that is needed for something, for a collaboration. So this needs to be a very well thought through, and it takes time. It takes time to talk to people, to show yourself, and then create, trust and relationship if you don't have it already. If you do, if you are someone or your organization is already in the communities and then you come with a new idea, it's much, much easier. But like, in many places that we did with the parenting program, I mean, APA didn't know that organization. I knew people, so, connect with the different people. So it is possible. And I would encourage, many of you to get out of the, your classrooms, you're safe and contain the world and really, knowledge. Yes.
All right. Well, thank you, Julia. Julia, I think you're muted. We can't hear you. We're running out of time too, and I want to be respectful. I think we have 1 minute.
Okay, I just want to share that.
Thank you so much, Julia. This has been very, very helpful to all of us, to many of us. Thanks to our wonderful expert panelists who joined us. Thanks for the reminder and helping us to renew our spirit of community partnership. I think all of us have that desire to be able to continue to be a part of the village around us and really be involved in the work that we are called to do. So thank you. And on behalf of Division 37, the Drain SIG, and on behalf of APA, and all of you, on behalf of our families and children all over the world, thank you for your leadership and thank you for everything that you do. And thanks for continue to move the needle in your local communities and work with those around you. Stop working in silos. Thanks. And with that, I am going to close. I put a chat in the chat box with a link. And so you can click that and be a part of this movement within Division 37. Thanks to my fellow coordinators. I see Steph and Carla and Sonia and all of you all. Thank you so much.
Thank you very much. It was really a pleasure to be here.
Thank you so much. It was great to be here. If you'd like to learn more about NBCDI, you can go to our website, nbcdi.org. Have a great weekend, everybody.
Thanks, Allison. And do you mind posting that in the chat box for those who are still here?
Yes, it's in the chat box right now.
Oh, great, great. Thank you. Dr. Macri, I know we're out of time. I want to be respectful of everybody's time. I'm not sure if you have any closing words. We're 1 minute past our time.
Yeah, but it's been great. I really appreciate, I'm actually have made that pivot to behavioral and mental health because I think it's really, really important, especially coming out of the pandemic. And as Allison talked about schools and all of these social events that we would like to participate in, but it'll take time for us to, to come back together. And I would like to, in the future, talk maybe about some evidence-based programs that are available via, on the internet, and just to be very, very cautious about participating or downloading apps that promise things that they really can't deliver and are not non-evidence based, especially when it comes to mental health. And I am participating as a commissioner on the governor's commission on suicide prevention, and as a healthcare provider or as a healthcare worker, it's really been devastating in our community. So I appreciate what the APA does, and I liberally read a lot of your publications because it really is helpful to disseminate that kind of information in a culturally and linguistically relevant manner. So thank you for all you do at the APA.
Thank you, Dr. Macri, and we are going to be sending some resources. So if you can send that over to me, we will forward it to our participants as well. All right, thanks everyone. With that, we are closing out the session.